Diabetes occurs when your pancreas cannot create enough insulin or your body does not properly utilize the insulin. This results in high glucose levels in your blood. This can cause negative effects such as damaging your nerves and issues with your lining of your arteries, which can increase the risk of stroke, heart attack, and cardiovascular disease.
There are currently 3.4 million people in Canada with diabetes. You're more likely to get diabetes if you're a male. As you get older, the likelihood of developing diabetes increases.
In 2014, healthcare costs for diabetes in Canada was $14 billion. People with diabetes are 3 times more likely to be hospitalized than people with cardiovascular disease. The healthcare cost in a population is 3 to 4 times greater if there's diabetes present than if there isn't.
First Nations individuals have a 3 to 5 times greater risk of getting diabetes. People with a lower socioeconomic status are more likely to develop diabetes.
Controlled risk factors for diabetes include poor diet and lack of physical activity.
An unhealthy diet consists of high carb, high sodium, and high cholesterol foods.
Eating at regular times helps to control your body's blood glucose. Limit sugar and sweets such as sugar and honey, as this will raise your blood glucose. Limit the amount of high-fat foods such as chips and pastries, as this can raise your cholesterol and lead to obesity. Eat high-fiber foods such as whole wheat and vegetables, as it may lower blood glucose and cholesterol. If you're thirsty, drink water. Limit alcohol consumption, as it can make you gain weight, which increases your risk of contracting diabetes.
A healthy amount of exercise can help to combat the risk of diabetes. It is important to have physical activity of all types, including aerobic and anaerobic exercises.
It is estimated that by 2025, the prevalence of diabetes will increase by 44%. This will also increase the burden of cost upon our healthcare system. Diabetes is one of the most preventable diseases that we face today, so we all must do our part to ensure that we end this epidemic.